lactation. So please remember, these are a total of 7 components which are covered under Psm1 care. When we look at Psm1 care, we should never forget it includes Psm1. Along with that, it includes provision for blood transfusion and surgery if required. So making it 7 plus 2, 9 components overall. Now, when we look at in this antenatal care, then one of the important things asked in our examination is antenatal visits. Now, when we look at antenatal visits, recommended are 13 to 14 in our country. So, first 7 months, once every month, 8th month, we recommend the pregnant female to visit health center twice in that month, and then 9th month onwards till delivery, once every week. So 7 visits, 2 visits and 4 to 5 visits, making it a total of 13 to 14 visits. This is ideal recommended number of visits. But if you are asked what is the minimum recommended antenatal visits in India, then these are 4. And when these 4 visits ideally should be undertaken, these 4 visits are undertaken. Number 1, registration of pregnancy. Second visit, 14 to 26 weeks period of gestation. Third visit, 28 to 34 weeks. And fourth visit is 36 weeks till term or delivery. Only WHO says these minimum antenatal visits should be 8. These 8 visits should be undertaken at 12 weeks, 20 weeks, 26 weeks, 30 weeks, 34 weeks, 36, 38 and 40 weeks period of gestation. Nothing is specified. Please mark the Indian answer always. Ideally recommended 13 to 14, minimum is 4. When we are asked about minimum postnatal visits in our country, now please be careful. Minimum postnatal visits generally recommended are 3 to 4. When I say minimum recommended are 3 to 4, actually I am talking of a visit which has to be undertaken by whom to the house of the delivered female, that is by multi-purpose worker female or ANM from the sub-center. In cases of home deliveries, 4 such visits are undertaken on day 1, 3, 7, 42nd day of delivery. In cases of institutional, 3 visits, no requirement on day 1. Now please remember, in visits, you are asked 2 things, either the number or the exact timing of these visits. Now please also remember that minimum postnatal visits are taken by MPW separately, and in India, ASHA worker takes it separately. That is known as home-based newborn care program. Again here, in cases of home delivery, 7 such visits are undertaken on day 1, 3, 7, 14, 21, 28 and 42. In cases of institutional delivery, there is 6 visits, no need on day 1st of the delivery. Again, number and timing are the important things which are required to be remembered whenever you are asked about visits in the program. We move further in preventive pediatrics. This is Salter scale. What is the use of Salter scale in public health? Salter scale is used for measurement of birth weight. or weight of an infant generally. Now, when we look at average birth weight in India, it is around 2.8 kilogram. Then what is low birth weight? When it goes below 2.5 kg, irrespective of gestational age. Moderately low birth weight, when it goes below 2. Very low birth weight, when it goes below 1.5 kg. And extremely low birth weight is below 1 kg weight on the day of delivery. So please remember this WHO classification of low birth weight. In India, prevalence of low birth weight is currently around 18.7%. Generally, when you look term or post-term newborns, term is 37 to 42 weeks period of gestation and post-term is after 42 weeks period of gestation. Sometimes they also turn out to be low birth weight. If such a situation is encountered, then these are known as, very right, these are known as small for date or small for gestational age newborns. They have a technical definition, less than 10th percentile weight for gestational age. Most common cause is IUGR for them. Please remember that birth weight doubles by 5 months, triples by 1 year, it quadruples by 2 years of age. Average birth length in India is 50 centimeters, increases by 25 centimeters in first year of life, doubles to become 100 centimeters by 4 years of age. Newborn's infant's length we measure by infantometer. Next we look at growth and development. Now when we look at indicators, what is the best indicator of growth, development, and if I ask nutritional status also, then please remember for all three it is same, and that is weight. Combination wise weight for age. Only remember, if you are assessing nutritional status, then mid-arm circumference through Shakir's tape could be used as the second best indicator, but overall weight for age is best to assess growth. In fact, you should be able to make a diagnosis if you are asked what is low weight for age, low weight for height, or low height for age. When I look at all the three, please remember all three are malnutrition indicators. Wasting is lesser weight for height. It is a marker of acute malnutrition. In contrast, if lesser height for age, that is stunting. That is a marker of chronic malnutrition. And what is left? Lesser weight for age. This is indicator of acute on chronic malnutrition, technically known as or diagnosed as clinically a case of underweight. All three are indicators of malnutrition. This is Shakir's tape used to assess mid-arm circumference, field instrument for that. Now when we look at Shakir's tape as an instrument to assess nutritional status of a child, then please remember its highest category, red value wise, when it goes below 12.5 centimeter, indicating severe malnutrition. Immediately refer the child. When we look at middle category, yellow. Yellow is when the child falls between 12.5 to 13.5. It indicates mild to moderate malnutrition. Primary health center medical officer is capable enough to manage this. And when we look at the third category, green, this is when mid-arm circumference is above 13.5 centimeter. This indicates normal nutritional status. Advise home management to the mother. Only exception is WHO, which says for severe malnutrition, cutoff should be taken below 11.5 centimeter. 6 months to 5 years of age. This secondary level of prevention Shakir step would be used. Passport to child's health growth chart. This is WHO growth chart. Growth chart initially given by David Morley, drawn between weight and age. This is having upper reference curve, lower reference curve. In between, there is a green shaded area known as road to health. When we look at upper reference curve, this is equivalent to 50th percentile of boys. Lower reference curve is equivalent to 3rd percentile of girls. Now please be careful. This lower reference curve is 80% value of upper reference, and lower reference curve lies 2 standard deviations below this upper reference curve. Originally based on National Center for Health Statistics USA standards. In contrast, when we look at ICDS growth chart used at Anganwadi in our country, this has got 3 lines. First is standard line, then is minus 2 SD, then is minus 3 SD line. Standard line is actually upper reference curve of WHO, 50th percentile of boys. Second line is 2 standard deviations below. This is actually lower reference curve of WHO, 3rd percentile of girls. In between road to health green. This is better than WHO because minus 2 to minus 3 SD. This yellow zone creates mild to moderate malnutrition, and red zone below minus 3 SD creates severe malnutrition. So malnutrition also is divided into categories. Based on WHO Child Growth Standards 2006, this growth chart, those standards are popularly now known as MGRS standards, multicentric growth reference study standards. MCH indicators, maternal child health. When we look, let us do it in a technical way. All these 6 maternal and child health indicators are based on mortality. All the 6 have common denominator live birth. All the 6 have same multiplier except MMR. Let's look at that. So IMR is infant death, MMR is maternal death, under 5 death, neonatal death, perinatal death. Perinatal death is 28 weeks of period of gestation till 7 days after delivery. Stillbirth, after 28 weeks period of gestation, more than 1000 gram birth weight on delivery or more than 35 centimeter birth length on delivery, dead born fetus or child is known as stillbirth. Maternal death is pregnancy, labor, delivery or within 42 days of delivery. Neonatal death is up to 28 days of age. I told you all of them have same multiplier 1000 except MMR. Maternal mortality ratio, actually the multiplier is 1 lakh. When we look at most common cause, it is low birth weight, prematurity. Both taken together as the common cause of death in IMR also, under 5 also, neonatal also, perinatal also. Single best answer, prematurity. But when we look at maternal mortality ratio, then postpartum hemorrhage is most common cause of death. Overall also, direct also. Indirect, it is anemia. Stillbirth rate, the commonest cause of death is maternal infection, abruptio placentae. Currently, IMR 28, MMR 97, under 5 mortality 32, neonatal mortality rate 20, perinatal 18, stillbirth rate 21. All of these are values for India per 1000 live births except MMR 97 per 1 lakh live births. IMR is the best indicator of health status of a country, health services availability, health services utilization, health services effectiveness, and state failure also. IMR is also the best indicator to evaluate ASHA's work. Perinatal mortality rate is the best combined indicator of maternal and newborn care. Under 5 mortality rate is the best indicator of social development of a country. After this, we look at breastfeeding. Now, breastfeeding, exclusive breastfeeding in India is recommended till 6 months of age, and breastfeeding, it is recommended in developing countries like India should continue till 2 years of age. When we look at immunoglobulin most abundant, it is IgA followed by IgD followed by others. When we look at vitamin, which is most deficient in milk, it is vitamin C. But when we look at breast milk, vitamin D is most deficient. But when we look at the advantage of the breast milk, then essential fatty acid, which is exclusive in breast milk, helps in brain development also. That is docosahexaenoic acid. Brain development is also helped by amino acid taurine in breast milk. Looking at the energy content, 65 kilocalories per 100 ml energy, and protein content is 0.9 to 1.1 gram per 100 ml. When we compare human milk versus cow's milk, then you realize that both have their individual advantages. Human milk is richer in lactose, iron, water content, and calcium phosphorus ratio. In contrast, cow's milk is richer in proteins, fats, energy. Although energy is only slightly higher, 67, and absolute quantity of calcium and phosphorus. Now, looking at some other nutrients, please remember human milk is richer in vitamin A, C, whereas cow's milk is richer in B and D. Human milk is richer in PUFA, essential fatty acid like linoleic acid. Also, it is richer in taurine along with cysteine. Cow's milk is richer in methionine. Human milk has a very good casein whey ratio, 40:60. It is not so good, 80:20 in cow's milk. As compared to cow's milk, human milk has not just higher quantity of iron, but very high bioavailability also. And despite human milk having lesser quantity of calcium, its absorption is higher due to high calcium phosphorus ratio. Breastfeeding initiation guideline ideally should be as soon as possible, immediately after a normal vaginal delivery. maximum within 1 hour. Caesarean section again as soon as possible, but maximum within 4 hours. Ideally, it should be started at delivery table itself. School health, first recommended by Bohr Committee in 1946. But school health guidelines were first given by Renuka Roy Committee in 1960-61. Healthful school environmental guidelines say one classroom should be for maximum 40 students. Per capita space that each school child should get should be minimum 10 square feet. Light should come from left side natural. Desk should be of minus type. Minus desk means overlap between the writing and the sitting surface. Also, doors and windows should comprise minimum 25% of floor area. Sanitation facility wise, there should be one urinal per 60 students, one sanitary latrine per 100 students. And recommended frequency of school health examination is ideally it should be carried out once every 6 months. This is a logo of Anmol. What is Anmol program, friends? In RCH, when we look at RCH program, this is ANM online. ANM online, auxiliary nurse midwife online. This is a software which is tablet based. All the RCS program related data entries done through this Anmol software tablet based environment. Disinfection of water you can do by boiling chlorine, ultraviolet rays, ozone gas and many other methods. Boiling is best, it destroys everything. But when you look at chlorination, chlorination practically has no effect on 6 disease causing agents. What are these 6 disease causing agents? It has no effect on bacterial spores, helminthic cyst, helminthic ova, cyclops, poliovirus and hepatitis A virus. So chlorination is not the best method when we compare with boiling, but it is better than other methods because at least it has free or residual action in drinking water. But when you need to calculate how much chlorine or bleaching powder should be added to water for disinfection, we use a specific instrument known as, this is Horrocks apparatus. So if you are asked, when we look at Horrocks apparatus, you can see there are 6 white cups and 1 black cup. What is it actually used for? It is used for chlorine demand estimation. Now Horrocks apparatus, these 6 cups are given numbers and they have markings to fill water in increasing level. After making indicator solution of the same water sample with starch iodide in this black cup, we put 2 drops of this indicator in all the 6 cups in which there is already water with increasing levels as marked. Any cup shows color change. Let's say 5th cup is the first cup to show color change. Then 6th will also show. If 4th is the first cup to show color change, then 4th, 5th and 6th will show. So then we have to memorize a formula. N into 2 grams of bleaching powder will disinfect 455 liters of this water. Where what is N? N is number of first cup to show color change. Compared to Horrocks apparatus, also remember bleaching powder has 33% available chlorine. Generally, 2.5 grams of bleaching powder is required for 1000 liters of water. When you add chlorine to water, multiple compounds are formed, but main disinfecting action is due to formation of which compound? 90% is through hypochlorous acid HOCl, 10% is through hypochlorite ions. Chlorine act best when pH of water is around 7. Now after chlorine had destroyed all the impurities, we add additional free residual chlorine in drinking water. This is to make sure water remains fit for drinking for next 24 to 48 hours. In India, in drinking water, this level should be minimum 0.5 milligram per liter or ppm, contact period of 1 hour. In swimming pools, this level has to be raised above 1. And if you really want to kill cyclops, then this level should be raised above 2. Now, how do you measure this free or residual chlorine level in water? That is done by an instrument, chloroscope. Name of the instrument is chloroscope. The test used is orthotolidine test, which tells you levels of free chlorine and total chlorine. In contrast, if you use orthotolidine arsenite test, that gives you free and combined chlorine levels separately. Although you can calculate all the three levels directly or indirectly from both the methods, please remember orthotolidine arsenite test is better. It works even in the presence of inorganic impurities. After water, we move to next component, air. Now in air, two instruments are important. First, on your left side is red color bulb at the end, Carta thermometer. What is the use of Carta thermometer in public health? Earlier it was used for cooling power of air. Now it is used to record low air velocity. Instrument on the right side is sling psychrometer. What is the use in public health for sling psychrometer? Like hygrometer, it is used to assess water or moisture content of air humidity levels. This is NAQI, National Air Quality Index, which has been given by Central Pollution Control Board, Ministry of Environment, Forest, Climate Change. National Air Quality Index, green to dark red, these are actually categories 0 to 50. This is known as good air. Then 51 to 100, light green is satisfactory. Yellow becomes 101 to 200. This is moderate. Orange and light red, 201 to 300, 301 to 400. These are respectively poor, very poor. And last, severe category. This is when air quality is 401 to 500. This is based on 8 parameters. These are sulfur dioxide. National Air Quality Index is based on sulfur dioxide, nitrogen dioxide, carbon monoxide. Along with that, particulate matter 2.5 also, particulate matter 10 also. In addition, lead, ozone, ammonia. a total of 8 components are there in calculation. When we look at best indicator of air pollution, then it is actually sulfur dioxide. In combination, sulfur dioxide, suspended particulate matter and smoke. Otherwise, soiling index, coefficient of haze, air pollution index are also used to assess this quality. Per capita air requirement is 300 to 3000, average 1000 to 1200 cubic feet per hour. When we look at radiation, 0.5 mm should be the minimum thickness of lead apron. Rajasthan is the state which is receiving maximum solar radiation in the country. Please remember, in housing overcrowding criteria, there should be, if more than 2 people per room, minimum floor space required 70 to 90 square feet per person is not there, or there is absence of sex separation above 9 years of age, then definitely overcrowding is present. Candela is the unit of light which represents brightness of point source. For satisfactory vision, 15 to 20 foot candles light illumination should minimum be present. Also friends, please remember that above 85 decibels to 90 decibels, there is auditory fatigue, above 100 decibel permanent hearing loss, and tympanic membrane ruptures above 150 to 160 decibels. Hospital wards, please remember this sound level should be 20 to 35 decibels. Coming to medical entomology, this is a female Anopheles mosquito. How we have identified by its two important features. One is it sits at 45 degree to the surface of skin while taking a bite, as you can see in this particular diagram. Second, it has got black spots on margins of wings. So its wings are black spots on margins, spotted wings. It transmits malaria. Anopheles culici faces rural malaria, Anopheles stephensii urban malaria. This is a mosquito which is resting parallel to surface of skin. This is having a small bend around the neck known as hunchback posture. So parallel with a hunch around the neck. This is Aedes. It could be Culex also, but Aedes we are saying because you can see white stripes on body and legs, known as tiger mosquito. So Anopheles sophisticated mosquito, Aedes tiger mosquito. It transmits important diseases: dengue, chikungunya fever, yellow fever outside India, Zika virus in India, and Rift Valley fever. And if it is parallel to surface of skin with a hunch, but there is no white stripes, that is Culex, which transmits three important diseases: lymphatic filariasis, Culex quincue fasciatus or fatigans, Japanese encephalitis, Culex tritineorhynchus, West Nile fever, Culex pipiens. We have to remember. This is sandfly. Biological name is phlebotomus. Now, what is the identifying feature? Its legs are 2 times longer than body. Wings are flame shaped, fine cuticular hair on margins of wings. It transmits Kala Azar, visceral leishmaniasis, oriental sore, cutaneous leishmaniasis. Kala Azar is caused by Leishmania donovanii, oriental sore is caused by Leishmania tropica. Please also remember, it can transmit Oriya fever, sand fly fever. Otherwise, it can also transmit Chandipura virus, Changuinola virus, Naples virus, Sicilian virus, Toscana virus, Adria virus, vesicular stomatitis virus, and many other similar diseases. This has insecticide of choice as DDT. It lives in the cracks and crevices of walls. So only spray should be done till the height of 3 feet on the walls where maximum it can jump up to. This is Anopheles larva. This is Culex aedes. Now what is the difference? When we look at Anopheles larva, they rest parallel to water surface because they have no siphon tube. Siphon tube is like our nose. So they rest parallel to water surface. Directly through water surface and skin they can get the oxygen. Look at Culex aedes larva. They rest at an angle to water surface because they have siphon tube. In contrast, look at the third image. This is Mansonia larva, which is attached to the roots of water plants. It does not need surface for breathing. Now, when we look at mosquito control measures, we can go for physical methods, we can go for chemical, we can go for biological. Physical methods, these include source reduction, which is the best method of mosquito control because it is primordial level of prevention. All other are primary. Then we look at mosquito nets. Mosquito nets, size of each hole should be 0.0475 inch diameter maximum, and there should be minimum 150 such holes per square inch of mosquito net. Chemicals, if you look, we have to know at least the 4 common ones: DDT, pyrethrum, malathion. These 3 are anti-adult. They kill the mosquito by acting as nerve poison or contact poison. Biomolecular level, they inhibit acetylcholinesterase enzyme. In contrast, Paris green is a anti-larval stomach poison. Biological control is achieved through Gambusia fish, Poecilia fish, Lebister fish, Barbados fish. These are larvivorous fishes. Gambusia has highest affinity for, yes, Anopheles larva. H14, bacterium Bacillus thuringiensis is also used. Silomomyces is the fungus which is used for mosquito control, and Toxorhynchitis is the mosquito used for mosquito control. 8 to 34 days is the lifespan of a mosquito on average. Nutrition and health. Nutrients are broadly divided into 3 groups: macronutrients, micronutrients, and trace nutrients. Can I say this classification is based on their particle diameter size? No. This is actually based on, yes, their requirements per day. So this is in grams per day. Micronutrients is in milligrams per day, and trace nutrients is in micrograms per day with few exceptions. When we look at macronutrients, these are 3. These are carbohydrates, fats, and proteins. Micronutrients are many, but importance to us exam wise and body wise include iron, iodine, zinc, calcium, and vitamin A. Now, when we look at their importance in body in providing energy, then energy wise, highest content is in, yes, that is in fats, 9 kilocalories per gram, followed by proteins, 4.2 kilocalories per gram, followed by carbohydrates, 4.1 kilocalories per gram. alcohol dry weight is having an energy content of 7 kilocalories per gram. Now this is arranging these macronutrients in order of reducing energy. What are proximate principles of diet? Proximate principles are, yes, a synonym of macronutrients. Now, a family with low education status, you have to tell them about the concept of balanced diet. Which is the best statistical diagram to use? Should I use a component bar diagram? No. I should use, yes, a pie chart. So, we are looking at now balanced diet. In balanced diet, you will first balance the nutrient which is most important for human body. I am not saying energy wise, importance wise. Most important is proteins. So protein should constitute 10 to 15% of our energy intake. This is followed by fats, which should constitute 15 to 30% of our energy intake. Rest, carbohydrates should constitute the remaining 50 to 70% of the total energy intake. We start with vitamin deficiencies. Can you make a diagnosis which vitamin deficiency is shown by this particular image? Yes, that is vitamin A deficiency, popularly known as the syndrome of xerophthalmia. Now, when we look at xerophthalmia, WHO classification divides xerophthalmia into two categories: primary manifestation, secondary manifestation. In primary manifestation, we have 5 categories: X1A, X1B, X2, X3A, X3B. In secondary, we have 3 specific features: XN, XF, XS. So we start with X1A. First to appear is, yes, conjunctival xerosis, popularly known as dry eye. And what is the specific feature of dry eye of vitamin A deficiency? It has a characteristic appearance like this. This is known as receding banks after a sea-tide appearance. Characteristically seen in xerophthalmia, vitamin A deficiency. Now this is X1A. What is shown in the image? Can you make a clinical diagnosis of this image now? This is Bitot spots. And Bitot spots, the most specific manifestation of vitamin A deficiency, this is actually X1B. Then we have corneal xerosis, corneal ulceration, and finally irreversible keratomalacia. Secondary manifestations have night blindness, nyctalopia, xerophthalmic fundus, and xerophthalmic scarring. When we look at first symptom is night blindness, whereas first sign is dry eye. When we look at first manifestation of xerophthalmia, please remember that is the symptom of night blindness only, and Bitot is the definitely most specific manifestation. When we look at vitamin A as a public health problem, xerophthalmia, then xerophthalmia is a public health problem if prevalence of night blindness is more than 1% and Bitot spots is more than 0.5% in the population. How do we treat cases of xerophthalmia? We use vitamin A oral solution. 3 doses are given on day 0, 1 and 14, and these doses are, if it is an infant, 1 lakh international units each. If it is after infancy, we give 2 lakh international units each across all the age groups. Please remember, this is secondary level of prevention treatment we are talking of. Infants in the first column, adults in the second column. Also, please focus that if child is malnourished and he is more than 1 year of age, even then the dose is given as 1 lakh international units only. Intramuscular dose is half of the oral dose in this particular treatment regimen. This is golden rice. You can see there is a yellow colored hue on this. What does this yellow indicate? Actually, golden rice is a genetically modified crop, and in genetically modified crop we can add anything. So we have added one of the commonest nutrient deficiencies in our country, beta carotene. So small amount of iron is also there, but this yellow color is due to beta carotene which is present, 35 microgram per gram of rice. This has been given by Indian Rice Research Institute. Let us move forward now. This is polished rice. Now, which nutritional disease polished rice is associated with? For that, you will have to understand the concept. See, generally, rice is a good source of many nutrients and vitamins, and almost all nutrients lie in its outer layer. What is done in Andhra, Telangana region? The shopkeeper polishes the rice. So what happens? Its outer layer is removed and rice starts shining. This is polished rice. It appears it is of very high quality, but because the outer layer is lost, all nutrients are lost, especially vitamin B1, thiamine. And thiamine deficiency leads to, yes, beriberi. So beriberi is seen in polished rice eaters in Andhra, Telangana region of India. B1 deficiency in chronic alcoholics lead to Wernicke-Korsakoff psychosis. This is food adulteration disease letharism or neuroletharism. Now, it occurs due to adulteration of arhar dal, which is not dangerous, but with the adulterant, a cheap dal, Lathyrus sativus khesri dal. And it is this khesri dal which leads to production of the toxin BOA. What is BOA? Beta oxalyl aminoalanine, which leads to classical manifestations. First is latent stage, then is one stick stage as seen in this image, then it becomes two stick stage, crawler stage, and finally even death of the person can occur. Neuroletharism, a form more common in humans, osteoletharism in animals. When we look at its prevention and control, a big role is played by vitamin C in prophylaxis also, treatment also. We can remove toxin by steeping method, parboiling method also. Banning the crop is another way that has been tried by the government of the country. We also give health education to the public that ideally this should not be consumed. If it has to be consumed, it should be constituting less than 30% of the total consumption, and some genetic engineering methods are now being tried also. This is, yes, Castle's necklace. Now, when I say Castle's necklace, what happens when a person goes out in the sunlight? There is a deep pigmentation of the skin. Now, this deep pigmentation, Cassell's necklace, is characteristically seen in which disorder? That is pellagra. So, pellagra is seen due to deficiency of, yes, it is niacin, vitamin B3 deficiency. See, generally, niacin is formed in our body from tryptophan continuously, and there is no problem. 60 milligram tryptophan converts to 1 milligram niacin on a daily basis. But if due to some reason tryptophan reduction is there in the body, deficiency is there in the body, niacin deficiency, pellagra will occur. Which group of people will have tryptophan deficiency? Tryptophan is a limiting amino acid of maize. So, maize eating population have this deficiency. Now, technically speaking, we do say that, okay, maize has deficiency of tryptophan, but in reality, maize does not have deficiency of tryptophan. Rather, it contains excess of some amino acid which directly inhibits this conversion. So, which amino acid is in excess in maize? That is excess of leucine. So, please remember, when we say pellagrogenic amino acid of India, that is not reduction or deficiency of tryptophan in maize, it is due to excess of leucine. So, leucine is known as pellagrogenic amino acid of India. So, it inhibits this chi-uridine K pathway, key step where the tryptophan is converted to niacin. So, pellagra is characterized by 4 Ds. These 4 Ds comprise of diarrhea, dermatitis, dementia, death. Now, a 5th D, delirium, 6th D, depression has also been added to the list. Protein. First importance is given to proteins. It should constitute 10 to 15% of our balanced diet. Quality of protein is best assessed by which indicator? That is best assessed by indicator DIAS, digestible indispensable amino acid score. Second best is PDCAS, protein digestibility corrected amino acid score. We can use net protein utilization also. Otherwise, biological value, amino acid score, and protein efficiency ratio is also a quality indicator. Protein energy ratio tells you about the quantity. When we look at net protein utilization, it is biological value into digestibility coefficient by 100, or how much nitrogen is retained by the body as compared to the total nitrogen intake into 100. When we look at NPU as an indicator of protein quality, highest NPU is in egg, and the value of NPU is 96 in the egg. Now, protein quality is highest in egg. This is due to best possible combination of essential amino acids. 10 essential amino acids are PVT, TIM, HAL. Which are these? These are phenylalanine, valine, threonine, tryptophan, isoleucine, methionine, histidine, arginine, leucine, and lysine. Leucine is most essential. Out of these 10 essential, which are not produced in body in complete quantity, they become essential in diet. 2 are semi-essential, and these 2 are histidine and arginine. They are produced in body generally in sufficient quantity, but when bodily requirement increases, infancy, pregnancy, adolescence, lactation, they become essential in diet. Now, this is about human body. When we look at food item, Limiting amino acid means deficient. So when we look at maize, maize is deficient in two amino acids, tryptophan and lysine. Similarly, when we look at wheat, we are looking at cereals. They are deficient in threonine and lysine. And when we look at pulses, pulses are deficient in methionine and cysteine. Single best answer, maize is limiting in tryptophan, wheat in threonine, pulses in methionine. Rice among cereals is a good source of lysine. This we have to remember. Now, therefore, we recommend a person should not keep on eating only one food item. Limiting amino acid will lead to deficiency. Eat food in combination like roti dal combination, rice dal combination. This phenomena is known as supplementary action of proteins. Two different food items must be eaten together so that they can supplement each other's deficiency. When we look at rich sources of food items, please remember that when we look at fats overall, so essential fatty acid, polyunsaturated fatty acid, separately we look at linoleic acid, arachidonic acid. Then for all the four, highest content is found in which food item? Richest source is safflower oil. Not in the choice sunflower oil, not in the choice corn oil, soybean oil. When we look at linolenic acid, then flax seed oil followed by soybean oil is the richest source. When we look at icosapentaenoic acid, fish oils are the richest source. Richest source of MUFA is olive oil followed by groundnut oil, and saturated fatty acid highest content is found in coconut oil. Now, beside these fatty acids, when we look at other nutrients, vitamin C, richest source is which food item? Absolutely right. It is Amla, Indian gooseberry, followed by guava among non-citrus fruits, and cabbage in vegetables. When we look at vitamin A overall, halibut fish liver oil is the richest source. Otherwise, in fruits we have mango, in vegetables we have carrots. Halibut liver oil also is the richest source of vitamin D, for which there is no plant source. Generally, no plant source is found for vitamin D and B12, but generally B12 deficiency only manifests in strict vegetarians because D is somewhat obtainable through sunlight. Also remember, for iron, richest source is dried pumpkin seeds. Right? Then when we look at egg, please remember egg is the richest source for which nutrient? That is cholesterol. We have already discussed egg has got highest quality of proteins. Why we are saying it has highest quality of proteins? Because it has highest NPU value of 96. Otherwise, it contains 6 grams fat, 6 gram protein, 30 milligram of calcium, 1.5 milligram of iron. It also contains 250 milligram of cholesterol, richest source, and 70 kilocalories of energy also. Now please remember, when we look at egg, it is highest quality of proteins, but highest quantity of proteins is found in soya bean. And how much quantity we are talking of? 43%. And not just protein, fat, energy content, and mostly vitamins, minerals are higher in soya bean as compared to other pulses. Quality is important, quantity is important. Which is more important is quality. Therefore, when we wanted to make the reference protein of India, not quantity, quality made egg to be declared as reference protein of India. We move further. This is which food adulteration disease depicted? This is ergotism. So please remember, ergot toxin, stored contamination of food grains like bajra jowar may lead to ergotism. Purple colored infestation of seed on the right side shows ergotism due to ergot toxin. Underlying organism is Claviceps purpurea. At household level, you can diagnose, detect ergotism in food grains also, and you can separate ergot from food grains also by using 20% salt solution, brine solution. Reference Indian man, woman. Man has a weight of 65 kilogram. Woman has a weight of 55 kilogram. Otherwise, when we look for both, the age group taken for both is 19 to 39 years for calculations. Both have weight by high percentile of 95th percentile, and BMI taken is normal for Indian population 18.5 to 22.99. All energy requirements are calculated for them only. When we look at RDA, recommended dietary allowance, it is actual requirement per day plus some extra. Why do we give extra? Is so that if you don't consume it for few days, no deficiency will occur. This extra is not given in the cases of only one nutrient, that is energy. Otherwise, it will accumulate as fat and obesity will occur. Please remember, RDA can satisfy needs of how much population? That is very high, 97.5% of population it can satisfy the needs of. When we look at energy requirements, they differ for adult man, adult woman. It also depends on whether they are sedentary level workers, moderate level, or like laborers, heavy level workers. When we look at our exam, you have to go through all the values, but if suppose something is not specified, it is better to mark the sedentary value. Energy requirements are measured in kilocalories per day. So when we look at adult male, he requires 2100 kilocalorie, 27 and 3500 kilocalories per day respectively in sedentary, moderate, heavy worker. Corresponding values for women are 1700, 2100 and 2700 kilocalories per day. Please remember, for a woman in pregnancy and lactation, energy requirement is higher. When we look at additional energy requirement in pregnancy and lactation, a woman requires 350 kilocalories per day additional in pregnancy, 600 kilocalories per day in first half of lactation, 520 kilocalories per day in second half of lactation. When we look at protein requirement, please remember, whether it is adult man or woman, protein requirement is absolutely same for both, that is 0.83 gram per kg per day. When we look at absolute value, 54 grams per day and 45 grams per day respectively. When we look at energy requirement for infant, then an infant requires 550 kilocalories per day in first half of infancy and 670 kilocalories per day in second half of infancy. Besides energy, protein, other important nutrient requirements, when we look at iron, it is measured in milligram per day. So 19 milligram per day is the requirement or the suggested intake for an adult man, 29 for an adult woman, 14 pregnancy and 23 in lactation. When we look at folic acid requirement, that is in micrograms per day, that is 300 to 20. In pregnancy, it becomes 570 and reduces to 330 microgram per day in lactation. Calcium, this is measured in milligram per day. Adult man, woman, pregnancy, it remains same. It increases to 1200 during lactation milligram per day. Vitamin A, which is measured in microgram per day of retinol equivalent. Adult man requires around 1000 microgram per day, 840 in a woman, 900 in pregnancy, 950 in lactation. Iodine, salt is the major source. Iodine requirement in microgram per day, 150 in adults, 250 in pregnancy, which further increases to 280 microgram per day in lactation. Vitamin D, new guidelines, international units per day, 600 for all adults. Male, female, pregnancy, lactation. Simultaneously, please remember, fluorine is a double-edged sword because fluorine deficiency excess both are equally common in India. So it is strictly preferred to be given in a range of 0.5 to 0.8 milligram per liter of water. Similar exact values for ppm, 0.5 to 0.8. Now we look at other food adulteration diseases besides letharism and ergotism. Epidemic dropsy occurs due to toxin sanguinarine. And where will sanguinarine reach in our body from? This is from Argemone mexicana oil, which is mixed in mustard oil. So patient develops dropsy. Dropsy means he will develop bilateral edema, congestive heart failure, glaucoma, visual disturbances and death. Please remember, nitric acid test is a very sensitive test for this. And sanguinarine, the mechanism of action is inhibition of oxidation of pyruvic acid, which leads to its accumulation in the blood. Endemic ascites is due to pyrrolizolidine alkaloids reported from plant Crotalaria, which is used in many food dishes in central part of India. Aflatoxin is the toxin on which the disease aflatoxicosis name has been given. It is due to aspergillus, which is found in contaminated groundnuts. Otherwise, brick powder in red pepper, dried papaya seed in black pepper, cow dung in coriander powder, and lead chromate powder in turmeric powder are well known adulterants. One of the most famous tennis stars ever, superstars ever, Rafael Nadal once mentioned, "My motivation is tomorrow, just one day at a time," right? Friends, what we do as a student, we keep on worrying about the end result and we fail to focus on the process sometimes. What will happen in exam? How will I attempt? What will be my score? What will be my rank? it brings undue pressure on us. What I will suggest, like Rafa mentioned, make a daily goal. Just one goal, one day at a time. You can make a complete schedule, that's not an issue. But when you are focusing, focus on the one day. When you are going to sleep tonight, please first have a look at what you are going to do tomorrow. So do this daily. Break your big goal into smaller goals. Focus on the process right now. Ultimate goal will definitely align according to whatever you want. All the best. Stay on course. We move to now social sciences and health. We start with the most popular topic. This is what is shown in this particular image is, yes, modified Kuppu-Swami scale. Modified Kuppu-Swami scale is used for urban families. For urban families, we have four scales: modified Kuppu-Swami scale, Kulshrestha scale, Srivastava scale, and Jalota scale. For rural families, we have Uday Parikh scale, modified BG Prasad scale, Radhukar scale, Shirpurkar scale. For international comparisons, we have two scales: Hollingshead scale, Henderson scale. And for students, we have one scale, that is Bhardwaj scale. When we look at this modified Kuppu-Swami scale, it is based on three components. These are education. This is for head of the family. Occupation, again head of the family. So this is a limitation of this scale. And then we take income into consideration. Then we divide it into three classes: lower class, middle class, and upper. Further divided into five subcategories. Please remember the score of upper class is highest, 26 to 29. So let's move to now definitions under sociology. What is social pathology? This is role of social factors in causation or occurrence of a disease. Poverty, illiteracy, overcrowding, ignorance, prostitution, STDs, alcoholism, tobacco consumption. How these lead to occurrence of disease, these social factors is social pathology. Culture is learned behavior which is socially acquired. Acculturation, as the word is telling you, it is mixing of two cultures, cultural contact. Marriage, trade and commerce, education, travel, all leads to acculturation. Internalization, this is imbibing others' values or virtues which you like and admire and make them your own. You internalize them into your personality. Then opinion, belief, attitude. Social psychology, some definitions. Opinion is temporary, provisional views. Very easy to change and very easy to influence others' opinion also. Opinions are generally subjective in nature. Please remember, beliefs are also subjective. It may vary from person to person. But what exactly is belief? Belief is permanent, more stable views on any person, object, or situation. Very difficult to change. They only change under extreme circumstances. Attitude is objective. Opinion, belief is in your mind. Attitude is more or less permanent ways of behavior. And this attitude develops. This attitude is based on organization of beliefs. This is acculturation, mixing of two cultures in any possible way. Health economics, if you look, GDP, gross domestic product, is total income generated within a country. As a country develops, then every year GDP will keep on increasing. Currently, India has been having highest GDP per capita economic growth rate in the world since last decade. Net domestic product NDP is GDP minus depreciation. Gross national income is GDP plus income which is received from abroad. And when we look at net national income, it is gross national income minus the capital we have consumed. Now, when we look at specific definitions under family systems of India, then traditionally there have been three different types of family systems. These are nuclear family, joint family, three generation family. Nuclear family is one married couple with or without their kids. When we look at joint family, it is more than one married couples with or without their kids. In joint family, males are related by blood, females are related to them. They have a common pool of income. They live under a common household. They have commonly held property, and generally some senior member, maybe male, maybe female, will be having the decision making authority in the family. Three generation family is three successive generations. Three successive generations. It automatically means it is a subtype of joint family only. Now, new family systems have emerged. Let's look at them. A term from RCH program, new family, is where marriage duration is less than 10 years. They should be targeted for contraceptive services. Communal family, each member has a defined role in management of the family. Problem family is a family which lags in progress behind the rest of the society. And broken family is due to death, divorce, or legal separation. Both parents are not together. Family cycle has 6 stages. Formation stage is right from marriage till first childbirth. Extension, the moment first childbirth occurs till that point to last childbirth. Complete extension, last childbirth to a Western concept, first child leaves home. Contraction, first child leaves home till last child leaves home. Then completed contraction, last child leaves home till death of a spouse. And finally, the last stage, dissolution, is from death of spouse till death of survivor. This is also known as extinction. In occupational health, we start with pneumoconiosis. What exactly are pneumoconiosis, friends? Pneumoconiosis are respiratory disorders which occur due to occupational exposure to dust. Now, this is a type of chemical hazard. Please remember. And most dangerous particle diameter size is not smallest, below 0.5 micron. Rather, it is second smallest, 0.5 to 3 micron diameter. This is considered most dangerous particle diameter size for pneumoconiosis. When we look at pneumoconiosis in India, these are the commonest pneumoconiosis. When we look at the which dust exposure leads to them, silicosis occur logically due to silica dust exposure. Anthracosis occur due to coal dust exposure. Asbestosis, as the word is telling us, asbestos fiber dust exposure. Bicyanosis occur due to, yes, cotton fiber dust. Bagasosis occur due to sugarcane. No, it is bagasse dust generated in sugar mill during production of sugar or molasses. Farmer's lung occur when a person is occupationally exposed to moldy hay. Compost lung, as the word is telling you, due to exposure to compost. Bird fancier lung occur when a person is occupationally exposed to bird droppings. And this is in the name itself. Sidrosis, sidrin, iron dust, stenosis, stannum, tin dust, two common metal industries of India. When we look at industrial associations, then glass industry workers are prone to develop silicosis. Cement industry workers also prone to develop silicosis. Some may develop asbestosis also. When we look at coal miners, anthracosis. When we look at sugar mill workers, bagasosis. When we look at textile industry workers, then bicyanosis. When we look at bauxite miners, they are prone to develop silicosis again. Now please remember, in India, silicosis is the most common pneumoconiosis, most common cause of death also, disability also. It shows snowstorm chest x-ray. Silicosis, clinical presentation quite similar to tuberculosis. When we look at disease associations, many literature believe that silicosis is associated with tuberculosis, mesothelioma, asbestosis, lung cancer, highest association again asbestosis, then progressive massive fibrosis, anthracosis. Then we look at microorganisms also playing a role in pathogenesis, then bagasosis, thermoactinomyces, species saccharii sugar, farmer's lung, micropolyspora, species pheniae, and compost lung, aspergillus, have been found associated. Now if you look, bicyanosis epidemiologically is most commonly seen in spinners. Bagasosis control in India is done by 2% propionic acid spray in the sugar mill industries of our country. Please remember, shipyard workers are very prone to develop asbestosis. Also remember, when we look at 4 notifiable pneumoconiosis, this include the 4 commonest pneumoconiosis of India: silicosis, anthracosis, asbestosis, bicyanosis under Factory Act of India. Monday chest tightness is the name given to bicyanosis. This is the logo of ESI, Employees State Insurance Act 1948. Now this is under Ministry of Labor, where employer contributes 3.25% of wages and employee contributes 0.75% of wages every month. Who can become a beneficiary? Those who are covered in a factory. Factory means where 10 or more people work together with power or electricity usage, or 20 or more people work without using power or electricity. It covers all the sectors, but it is not applicable on defense, mines, railways. For beneficiary, income cutoff is it should be less than 21,000 per month. Now, when we look at the benefits which are given under ESI, then sickness benefit is 70% wages for 91 days. Extended sickness benefit 80% wages for 2 years. So this duration you have to memorize. When we look at disablement benefit, 90%. When we look at dependence benefit, again 90% of the wages. When we look at maternity benefit, it is 100% of wages for 26 weeks. Funeral expenses 15,000. Now, if there is no located nearby ESI medical college, hospital or dispensary, then we involve registered medical practitioners to provide them with indirect pattern medical benefit. Factory Act of India, factory definition is just like ESI definition. Factory Act is not applicable on defense, mines, railways and eateries, food joints. Under Factory Act, recommended per capita space to a factory worker is minimum of 500 cubic feet. There should be one safety officer per 1,000 workers. Work hour duration should be 9 hours a day, maximum 48 hours a week. Along with overtime, you can extend it to with separate payment to 60 hours a week. Now, please remember in Factory Act, legal cutoff age for employment is 14 years. So, child is taken as up to 14 years of age in this act and adolescent is 15 to 18 years of age. Above 18 years is adults whom we can employ directly. This is make a diagnosis. Yes, this is a slide showing lead poisoning, commonly known as plumbism or saturnism. Plumbum is lead. This is most commonly seen in painters. So it is also known as, when we are looking at occupation, painter's colic. First sign is pallor. This is perioral facial pallor. This is also the most consistent sign. Otherwise, blue line on gums, Burtonian line, chemically composed of lead sulfide. Classical presentation in emergency, long nerve palsies lead to wrist or foot drop. There may be lead colic, lead encephalopathy. Barring encephalopathy, if you leave aside encephalopathy, other 4 manifestations are due to inorganic lead exposure. When we look at its screening test of choice, that is coproporphyrin in urine. Diagnostic test of choice is aminolevulinic acid in urine. CPU cutoff is 150 microgram per liter. ALAU cutoff for diagnosis is 5 milligram per liter. When we look at drug of choice, that is EDTA plus dimercaprol. Second line of choice is penicillamine. When we look at prognostic test, that is peripheral blood smear, which has two different changes you can observe easily. One you can see here also, basophilic stippling of RBC, blue colored punctate dots, and second is microcytic hypochromic type of anemia. This disease, the most common source is petrol or vehicular fumes. Therefore, the most common mode is inhalation. Ergonomics, study of man in his occupational environment, is actually right man in right job. Or we can say it is fitting job to worker. Now, when we look at ergonomics as a science, occupational health examination is of two types. We have pre-placement examination done before placing a person in job. So, we will not give him job if he is already having some related problem. So, this is primary level of prevention, specific protection. But if person is healthy, we give him the job, and then we do post placement periodic examination, generally done once every 6 months or different exposure, different frequency. This is for diagnosis. So secondary level of prevention. Deep sea divers may develop decompression sickness due to low pressure when they ascend very fast from bottom towards the surface of the ski. We look at occupational cancers. Now, when we look at occupational cancers, specific associations, polyvinyl chloride exposure, angiosarcoma of liver. When we look at asbestos exposure, we have discussed mesothelioma and lung cancer. Lung cancer also occurs due to silica exposure and occupationally radon exposure. When we look at nitrogen dyes, aniline dyes, they lead to bladder carcinoma. That is mostly transitional cell carcinoma. Similarly, benzidine exposure also leads to that. But when we look at benzene exposure, that is associated with leukemias. Also remember nickel, chromium, wood dust. They are associated with nasal sinus, nasopharyngeal carcinoma. Biomedical waste management. This is covered under Ministry of Environment and Forest and Climate Change. After the modification in the 1998 biomedical waste management rules, it now covers 4 biomedical waste management categories. Environmental Protection Act 1985-86 is the overarching act. First logo is of biomedical waste. In case it's not given in the choice, please remember it also is the logo of all types of infectious waste or biohazard. Second logo is, you have seen outside the CT scan lab and X-ray rooms of your hospital, right? Medical college. So this is radiation hazard symbol. Now, if you look carefully in this radiation hazard symbol, we have got an outer circle, this one, and an inner circle also. Then please remember, inner circle radius is 1.5 r, outer circle radius is 5 r, where what is r? R is the radius of black dot in the center. So this is about radiation hazard symbol that we should know. Now let us look at biomedical waste management categories. Type of waste goes into which bag, what is the final disposal mechanism is asked. I am telling you a shortcut by going in the reverse direction. This is blue category. So which type of waste actually goes into blue category? Blue category waste includes all the metallic implants. So orthopedics, ENT, cardiothoracic vascular surgery, even dentists use a lot of metallic implants. One of the good examples is pacemakers. So pacemakers of the heart are also disposed after using blue category. This category also includes all glassware. And what is the final disposal mechanism of blue bag? Now, after subjecting the waste to autoclaving, hydroclaving, microwaving or chemical treatment, it is finally sent for recycling. So please remember, blue bag is subjected to recycling. Then we look at white container. It's not a bag, it's a container. What is the reason that this is made a puncture proof container? Absolutely right. This contains metallic sharps. So sharps waste. So this will include scalpels, surgical blades, scissors, needle part of syringe also. What is the final disposal mechanism of this waste? Now when we look, after subjecting them to autoclaving dry heat, they are sent for destruction shredding and finally they are put to use in iron foundries. Otherwise, landfill or sharp pits also, they could be disposed of. White container. Then this is the final two categories, yellow category and red category. Now when we look at yellow category first, yellow category include majority types of waste. So this include waste like human anatomical waste, placenta after delivery will go into yellow category, amputated fingers, limbs, gallbladder, appendix after appendectomy, any type of animal waste, any type of soiled waste. Soiled waste includes any cotton or cloth material contaminated with pus or blood, bandages, dressings, swabs. These all will go into soiled waste, even gauze pieces. Then we have chemical waste. Along with that, discarded medicines and cytotoxic drugs. So you tell me which medications are logically discarded. These are expired medication. They also go into yellow category. Then microbiological and biotechnological waste. This includes your live attenuated vaccines, sera, toxins, immunoglobulins, all will go into category yellow. Then a new category introduced, bed linen mattresses. And also any type of liquid waste. Now, when we look at yellow category, this waste, what is the final disposal mechanism? What is the final disposal mechanism of yellow category? That is incineration. Except liquid waste, which after chemical treatment is thrown into drain, yellow category is disposed by incineration. Now, finally, we look at red category. Which type of waste are thrown into red category? This include waste like contaminated recyclable waste. So, this would include all your plastic and rubber waste, plastic part of syringe, Foley's catheter, Ryle's tube, any Euro bag would also be covered under this. Gloves are also going to be covered under red category. So, what is the final disposal mechanism for this particular bag? Now, when we look at red category, after autoclaving, hydroclaving, microwaving, they are subjected to destruction shredding, and finally it is sent for road making. Otherwise, energy or fuel oil recovery also we try to do. Now, please remember friends, generally Euro bag or plastic bag goes into red. But if that Euro or plastic bag contains blood, then it will go into yellow. Now we look at specific types of methods one by one. This is autoclaving. When we look at autoclaving as a method, then it is steam under pressure with the principle with which it works. Now, it has a temperature of 121 degrees centigrade mostly. Pressure used is 15 psi for a duration of 45 minutes. And when we look at how do you check sufficiency of autoclaving, we use spores of organism Geobacillus stereothermophilus. Now, hydroclaving is also same. It is done hydroclaving at 132 degrees centigrade, steam under pressure. But when we use organism to check sufficiency of hydroclaving, that is Bacillus subtilis. Looking at other methods used in Indian hospitals and medical colleges for disinfection, sterilization, incineration works at a high temperature of 1200 degrees centigrade. So, it has a principle on which it works is high temperature and dry oxidation. Now, generally incineration we can use for any type of waste, but it should never be used for radioactive waste, which should be having C burial. It should not be used for reactive chemical waste. Like X-ray films, we extract the silver first. It should not be used for heavy metal waste, lead, cadmium, mercury. It should not be used for PVC plastic waste. Toxic fumes may lead to angiosarcoma of liver. It should not be used for pressurized waste. Chances of explosion should be there. And it also should never be used for red bag, as the plastic material of red bag contains cadmium. When we look at microwaves, these are 12 nanometer 2450 megahertz waves. These waves lead to sterilization or disinfection by generation of convection currents in heated water molecules. Now, when we look at microwaves, its sufficiency you can check by using the organism Bacillus atrophius. Now, please remember friends, not just microwave sufficiency, dry heat sufficiency also you check by using Bacillus atrophius. Dry heat is done above 185 degrees centigrade. Hot air oven is 160 degrees centigrade. Now, when we look at new methods, then one you should know is if you are having large volume of toxic biomedical waste, our first priority is to immediately convert it to non-toxic waste. Then we can store it and we can dispose it off slowly on a daily basis. Now, for doing this, what is the method used and what are the chemicals which are used? The method is known as inertization. Now, please be careful in the exam. I am not saying incineration. You have to read carefully. We are making the material inert. And what do we use for inertization is 15% cement and 15% lime. 65% is waste, 5% is water. What is SFT? Screw feed technology. Now, when we look at this new method of biomedical waste management, then it is very similar to what you have seen on construction sites. We have big drums in which we put biomedical waste plus inertization material like cement. Then we start rotating these drums like they do at construction site on trucks, and we start giving heat from below. So, what is its principle? It is a non-burn dry thermal process. What is the advantage we get? It reduces weight by 20 to 25% and it reduces the volume of biomedical waste tremendously by up to 80 to 85%. This screw feed technology is used for any types of infectious waste and sharps also. But this screw feed technology is strictly contraindicated for radiological waste, cytological waste and pathological waste. Mercury spill. How will you collect the mercury drops? These are collected by using cardboard. If not available, we can use plastic syringe also, and then these mercury drops are put into a plastic cup or bottle of water, sealed and sent to the lab for recycling. Please remember, final disposal mechanism of mercury in India is recycling. We can use sulfur or zinc powder to absorb if any smaller drops are left. Sodium thiosulfate powder could be used for decontaminating the surface also. Blood spills. A unit of blood falls on the floor. Now it is rendered useless for us. But how do we dispose this particular biomedical waste? We use sodium hypochlorite. Sodium hypochlorite, it is recommended that we should use 1% for smaller blood spills and 10% for larger blood spills. HIV infected material also should be pre-treated with sodium hypochlorite. E-waste, electronic waste should be sent for recycling. When we look at TB sputum disposal, then its best method is collect in a paper bag, send it to incineration in the hospital. Otherwise, dry burning at home, 5% cresol, boiling and autoclaving could also be used for TB sputum disposal in our country. We come to the unit of disaster management. Now, what is disaster is where 30 or more people simultaneously require hospital emergency services. So, this includes natural disasters like earthquake, floods, tsunami, volcanic eruptions. It includes man-made disasters like railway accident, truck accident, even terrorist attack. Epidemic is also covered under the definition of disaster management. Please remember, if requirement outruns this hospital supply, that is a disaster. What is disaster mitigation? It is defined as prevention of conversion of hazard or risk into disaster. Now, we cannot prevent earthquake from coming, but engineering measures are used. Do not construct building more than 1 floor high. Use maximum wooden material so that in case disaster comes, at least the damage is minimum. So, this disaster mitigation, actually the practical meaning is what measures you can take to minimize the damage. When we look at surge capacity, it is ability of a health system to respond to disaster situations. Like India has good surge capacity in management of cyclones. Now, one of the key features of disaster management, one of the key topics is the concept of, yes, this is triage. Now, what is triage? Triage is categorization of victims of disaster, which is based on. So, can I say it is based on severity of injury? Answer is no. It is rather based on likelihood or chances of survival. Let us try to understand. When we look at triage, which is done by professional teams, there are 4 categories. Category 1, highest priority is red. Category 2, yellow, sometimes blue, high priority. Category 3, low priority, green. And finally, category 4, black, is least priority or last priority. Now, which type of patients are categorized into them? When we look at category 1, red category, those who require immediate resuscitation or limb oblique life-saving surgery in 0 to 6 hours. That is category 1 patients. When we look at yellow category, this includes patients who may require possible resuscitation or limb oblique life-saving surgery in 6 to 24 hours. So, patient can wait for some time. Category 3 would include non-life threatening minor injuries. Patients can wait. So, this will include your ambulatory patients. And finally, 4th category, black. This is for dead people or moribund patients, so seriously affected, about to die. Most seriously affected are last priority. So, it is not based on severity of injury, rather it is based on how many people we can save, or we can say likelihood of survival. This color coding system of triage is known as tagging. Triage should be done at site of disaster by professional teams. If it is done by lay persons in remote inaccessible areas, that is known as START, simple triage and rapid treatment. Reverse triage in wars, we give first priority to minor injury in the soldiers. Post disaster phase, most common disease affecting is acute gastroenteritis, diarrheal diseases, typhoid, cholera. Respiratory diseases also spread in camps. Skin infections like scabies, fungal disease also spread. Even diseases like leptospirosis, which is due to infected rat urine, spread after a disaster like earthquake or flood. In fact, in Pathanmitra district of Kerala, we used zinc phosphide as the rodenticide. There is no reason why Kala-Azar leishmaniasis should spread after a disaster. Most common vitamin deficiency is vitamin A, xerophthalmia. Otherwise, niacin deficiency pellagra and C deficiency scurvy also occur. What is the status of vaccination in post-disaster phase? It is contraindicated. All vaccines, especially 3. These include typhoid vaccine, cholera vaccine, and tetanus vaccine. So all vaccines are contraindicated because they take a lot of time to form the immunity. By that time, disease having the shorter incubation period would occur. Only exception to this rule, only vaccine which is used after disaster is measles vaccine. And what is the reason? Reason is measles vaccine forms protection faster than the natural incubation period of the disease. Now, vaccine which is contraindicated post disaster in population actually becomes mandatory for health professionals, doctors and nurses. And these vaccines are exactly these 3: typhoid, cholera, tetanus. So what is contraindicated in population is mandatory for doctors and nurses. You cannot give vaccination. So you should go for most important preliminary step in post disaster phase is chlorination of all the water bodies in the area. Now when we are going for chlorination routinely at our household level, we look at residual chlorine level of 0.5 milligram per liter, but here we try to maintain a minimum of 0.7 milligram per liter residual chlorine. Preferably it should be 1. Now we should also know who is responsible for disaster management in our country. Nodal ministry, nodal center. When we look at nodal ministry, that is, can I say Ministry of Health? No, that is Ministry of Home Affairs. Now, nodal center is created at district level, not at primary health center or state level. We have World Disaster Reduction Day on 13th of October. Generally, maximum mortality in disasters is caused by which type of disaster? Yes, floods. So that is hydrological disasters. And what is the worst man-made disaster till date? That is India's Bhopal gas tragedy. 3rd December 1984, methyl isocyanide single exposure point source epidemic. A national level body, National Disaster Management Authority. We have Prime Minister as the chairperson. Genetics and health. We look at ABO blood group system. This was given by Carl Landsteiner. We know there are 4 major blood groups here: A, B, AB, O, where the commonest blood group in India is O, 40%. followed by B 33%, followed by A 22%, and AB blood group is the least common blood group. When we look at universal donor, that is blood group O, especially O negative. When we look at universal recipient, that is AB, especially AB positive. Is it possible a person may have neither A nor B nor AB nor O blood group? Yes, that is Bombay blood group, which is characterized by absence of H antigen. H antigen is required for the expression of ABO blood group. So what is the problem with this Bombay blood group people? They cannot receive blood from any other person except who is Bombay blood group. And Bombay blood group, we don't do routine typing in the country. So we only come to know after a severe transfusion reaction occurs. RH, rhesus isoimmunization. Now when we look at rhesus isoimmunization, when is it seen? Rhesus isoimmunization is generally seen if mother is dash, fetus is dash. This is seen if mother is Rh negative and delivered child or fetus is Rh positive. It is generally seen in second delivery or pregnancy. It may on the milder side may have nothing or mild icterus, but it may keep on increasing. On the higher side, it may have erythroblastosis fetalis. Death may also occur. Rarely it is possible to see this in first delivery also, in case there is a prior history of mismatched blood transfusion or there is a prior history of abortion or miscarriage with a Rh positive fetus. Now friends, please remember, how can we prevent this rhesus isoimmunization? We use anti-D globulin at 28 weeks period of gestation, and as per requirement it should be repeated within 72 hours after birth or delivery. Eugenics, here answer lies in the word itself. Eugenics. So what is euthenics? This is environmental manipulation. And what is eugenics? This is genetic manipulation. Now, why we are looking at manipulation, environmental or genetic? This is to allow expression of genes. Let's take an example. When we look at euthenics, it could be something like disabled friendly schools. We cannot treat a Down syndrome child, but in a disabled friendly school, he or she can learn the basic functioning of life. Eugenics could be positive eugenics or negative eugenics. When we look at positive eugenics, this includes in vitro fertilization, gene cloning, egg embryo transplant or gene therapy. Negative eugenics include abortions, sterilization or other methods of family planning. This diagram represents Hardy-Weinberg law. Now, what does Hardy-Weinberg law states? It is a law of population genetics which states that frequency of genes remain constant from one generation to another. Now, Hardy-Weinberg law is applicable if there are large populations, static population, their numbers don't change much, and random mating populations. In contrast, Hardy-Weinberg law is a failure if there is small populations, dynamic population, dynamic means changing numbers, if there is non-random mating populations, assortative mating populations, selectively mating populations. Even Charles Darwin's natural selection theory, Hardy-Weinberg law, is a failure if there is any mutation, number of genes may change, if there is gene drift, gene flow, then also it's a failure. If there is too much of migration, also it will lead to Hardy-Weinberg law failure. If I show you a 2 by 2 table like this with markings, like this, so can you tell me what is this diagram known as? This diagram is used in predicting the genotype of offspring in Mendelian crossbreeding experiments known as Punnett square. This is logo of Human Genome Project. This project was launched to completely sequence the human genome. So has that been achieved? Answer is yes. It started in 1990 and continued till April 2003. Initially the head was Dr. James T. Watson. This particular human genome project was able to find that there are 19,500 genes in human genome. Along with that, there are 3 billion base pairs. Now, this particular project did not use the modern techniques for splicing or chain termination. Rather, the classical techniques of Sanger and Maxim Gilbert were used for chain termination. Amniocentesis. Now, amniocentesis in India, secondary level of prevention, we have got 3 valid indications. One, if mother's age is more than 35 years. Number 2, there is a prior history of any genetic, metabolic or chromosomal anomaly. And finally, if there is any particular valid health related or medico legal reason where sex determination is warranted. Now we move to mental health in allied health disciplines. If you look, mental health disorder in India, most common has been depression, and that too unipolar. This is followed by alcohol disorders, schizophrenia and bipolar disorders. It leads to a loss of 1400 Delhis per 1 lakh population every year. When we look at suicides in India, latest National Crime Records Bureau data, if you see, then you will find that suicide rate in the country is 12 suicide per 1 lakh population every year, and the most common mode since last 10 years still continues to be hanging. Now, when we look at legislations and programs in our country, National Mental Health Act 1987, it has now become National Mental Health Care Act in 2011. Now, under this latest National Mental Health Care Act of India, several changes have taken place. Two key changes are: first, there is now decriminalization of suicide. And number two, now electroconvulsive therapy has been banned until unless there is some valid medical legal indication. Now please remember, mental health program was launched in 1982. Subsequently, district mental health program was also launched. And now we have National Suicide Prevention Policy. It came in the year 2022, where we want to reduce suicides in the country by 10% by the year 2030. Most common substance abused is tobacco. And most common narcotic substance abused in India, 63 per 1000 users was the older data, that is cannabis. Health, education and communication. We look at first of all the communication process. Now when we look at communication process with a special focus on health communication process, then we find it has got 5 components. First is the source or the sender. In cases of health, it is the relevant ministry or the health program, usually Ministry of Health. Then second is channel or the medium. For channel or medium, the message is encoded. The message or the content becomes the third component. And after decoding, it is received by the targeted audience or the receiver. Never forget that there should be a feedback, fifth component, from audience to the sender, communication process. Now, when we look at different health communication methodologies, you have to understand the method and whether it is one-way didactic or two-way Socratic in nature. We look at first method, one person addressing audience. This is lecture, also known as chalk and talk method. As per the guidelines, a lecture should have maximum audience size of 30 and ideal duration should be 15 to 20 minutes. It is one-way communication, purely didactic in nature. No question answering is permitted either during or after the lecture. This is panel discussion. Now, what is panel discussion? You can see in front of you in the image, there is a panel of 4 to 8 experts who discuss in front of audience. Audience will listen. Now, please remember, in a panel discussion, there is no specific sequence and there are no set speeches like a news channel debate, you can say. Also, please remember that panel discussion at the end is followed by a question answering session where audience can clarify their doubts. So, this is a type of Socratic method of health communication. This is FGD, focus group discussion. Now, focus group discussion is a discussion among 6 to 12 persons where one of them acquires the role of a group leader. It is you as a doctor or the medical officer, and one is a recorder. Discussion. So, it has to be Socratic two-way method of health communication. And when they are discussing, the recorder also has to draw a diagram where if one participant is speaking to another, a line is drawn between them. Similarly, very soon it will become a complex diagram showing lines of interaction. So, this geographical diagram, this physical diagram, which shows interaction between participants in a focus group discussion is known as sociogram. A good sociogram would be more balanced. Now, look at this. Here you can see some participant is not at all participating. Some are over participating. So, sociogram helps you take initiative to make the discussion more balanced in a focus group discussion. Demonstration is like ORS preparation. Teaching women of urban slum. Demonstration is based on two principles. These are learning by doing. So, it is a Socratic two-way method, and seeing is believing. When we look at flannel graph, flannel is the cloth. It is series of photographs which are pasted on a piece of cloth in correct chronological sequence. Like if I have to teach you about life cycle of Plasmodium, I'll arrange the photographs for all the stages and paste one by one and start explaining, and pasting would be done on a piece of cloth, flannel. Spikes technique, communication of cancer diagnosis and prognosis, but we can use it for any adverse outcome where actually spikes is an abbreviation, protocol, P spikes of 6 steps: setting up interview, assess perception, invitation to explain, giving them knowledge about everything of that cancer, patient family member may show emotions. In the end, as a doctor, you have to give summary and strategy how you are going to manage the patient. Used for multiple conditions. Major use has been found in communication of breast cancer diagnosis, prognosis. Gather approach is used for contraceptive counseling in RCH program. Again, it is a 6-step approach. As a medical officer, greet the couple, ask them about their contraceptive requirement, tell them about the available methods at your health center, help them choose the best method, explain how to use the method, what to do if side effect occurs, and finally expect a return visit. Earlier, this method was known as cafeteria approach. Contraceptive counseling. Doctor-patient communication. Now, when we look at doctor-patient communication, we have three such levels of doctor-patient communication. What are these? Based on doctor's competence, knowledge, skills, and patient's understanding, we have first level intellectual, emotional bonding between doctor and patient, second level, and cultural level. Same region, religion, socioeconomic background also leads to creation of cultural level of doctor-patient communication. When we look at adoption of a new idea or practice, let us say like hand washing for the first time by a family belonging to lower socioeconomic status. What is the sequence of steps? First is awareness. A family comes to know, okay, hand washing is something useful, so their interest is generated. How it is going to benefit them in disease prevention and control? So they meet a doctor like you and evaluate the technique. You tell them how frequent hand washing can prevent spread of fecal diseases. Then they will go for its trial. And if they find it useful, they will finally adopt the idea or the practice. So, using the mnemonic ITA, we can remember 5 steps in adoption of a new idea or practice. Friends, one of the greatest basketball players this planet has ever seen, Michael Jordan. He once mentioned that he had missed 9,000 shots. He had lost over 300 games. And it was at least 26 times he was given the final shot to take his team home. But he could not manage and his team failed. But these were the failures, these were the misses he was counting on just to showcase or tell you or advise you or inform you that it is the success which is built upon the pillars of failure only. Therefore, he turned out to be one of the most successful sportspersons in the history of the game. So, you also don't warp about your failures. Keep on focusing on the current process, looking at the final outcome of success. Ultimately, you will reach there. Stay on course. When we look at planning cycle, we have 8 steps. By the mnemonic IOPINE. First is analysis of existing health situation. What is the current incidence, prevalence, mortality, available services for that particular disease or for which you are going to launch the program? O is objectives and goals formulation. Third step is resource assessment. What resources are there at our disposal? Then prioritization, planning actually. Sixth stage, implementation. Seventh stage, monitoring. And 8 stages evaluation. So remember, planning cycle starts with analysis of existing health situation and it ends with evaluation of the program so that we can plan the next cycle of our program in much better way. We start with Health Planning Committee's Bhor Committee 1946, also known as Health Survey and Development Committee. It gave the important recommendations of. So 5 key recommendations that you should know. It includes primary health center, 1 per 40,000 population. This was a short-term plan. Long-term or 3 million plan was also given by Bhor Committee 1946. Bhor Committee mentioned that there should be 75 bedded unit at primary level, 650 bedded at secondary level, 2500 bedded at tertiary level in our country. It gave the concept of social physicians, that there should be 3 months internship after MBBS in the subject of PSM. It gave the concept of school health for the first time, and it also gave the concept of comprehensiveness of healthcare. This comprehensive healthcare concept includes three components: promotive, preventive and curative component. Then came Modaliar Committee 1962 Health Survey and Planning Committee. It repeated the recommendation 1 PHC for 40,000 and gave the concept of All India Health Services. Chadda Committee gave the concept of basic health worker. Mukherjee Committee gave the concept of basic health services. Then came Jangalwala Committee 1967. It gave the concept of integration of health services. It also recommended there should be a ban on private practice by government doctors. Also, it recommended in field of medicine there should be equal pay for equal work. Kartar Singh Committee 1973, it gave the important recommendation of multi-purpose worker at a sub-center. It also posted health supervisor at a community health center. Shri Vastava Committee 1975, also known as Group on Medical Education and Support Manpower. It gave the important recommendations of village health guide at village level, health assistant at primary health center level 1 per 30,000 population in plains and 20,000 population in hilly areas, ROAM scheme, reorientation of medical education. It also gave the concept of bands of semi-professional and para-professional health workers. It also gave the concept of referral services complex, that a patient should be referred from primary to secondary to tertiary level. High level expert group committee 2011 gave two important recommendations. One was universal health coverage and second was 3.5 year rural MBBS course, which was actually not a MBBS course but rural graduate course, BRHC, Bachelor of Rural Health Care in the country. In any program we have objective, targets and goals. Objective is any specific pre-planned activity in a health program. We want to achieve the goal through these objectives. Target lie in between objective goal. Goal is the ultimate desired state. What we want to achieve by that particular health program. Target is degree of achievement of objectives. Usually target has a timeline. It is the goal which is not constrained by time or even resources. It is the goal which shows all or none phenomena. Now we move to health management techniques. We look at cost benefit analysis. Please remember, input we know, But when you can measure output of a health program in terms of money, that is your benefit. TB program is saving 12 million US dollars every year. But if I say TB program is saving 12 lakh lives in the country every year, that is cost effectiveness analysis. Cost effectiveness analysis, effectiveness is output of a health program in terms of results achieved, number of lives saved, number of infections reduced, number of disease incidents prevented. Systems analysis is comparison of two or more cost effective alternatives. In a health program. So compare their cost, compare the result and choose the better one, that is known as systems analysis. Sputum smear as compared to PCR for TB, results are not as good, but cost is tremendously low, right? This is network analysis. Now, when we look at network analysis as a management technique, it has got two components. One is PERT, as it is shown in this diagram, program evaluation and review technique. This is actually sequence of activities in a health program. And its second part is CPM. What is CPM? CPM is critical path method, where critical means, what is the critical path? It is the longest path in terms of duration. Take an example. If you look at this particular diagram on the screen, you can see there are three paths. This pink colored line is the first path. This blue colored line is the second path. And this red colored line is the third path. So if I say these are 1, 2, 3, can you tell me which path is most critical for the success of this program? So look at the duration. We look at path number 1. You can see 3 weeks, 1 week, 3 weeks. So a total of 7 weeks duration. Look at second blue line. We have here 3 weeks and 2 weeks. So a total of 5 weeks duration. Look at the third red path. Here you can see we have 4 weeks, 2 weeks, giving a total of 6 weeks. So most critical for the success of this program is the longest path in terms of duration. Path number 1, pink colored path, 7 weeks, highest duration, most critical. Now looking at other management techniques, work sampling is sampling to assess quality of work in hospital staff, doctors, nurses. Zero budget approach mentions there should be no fresh budget allocation in the coming financial year until and unless previous is spent or zero. Then SWOT is an abbreviation in this technique. S is strengths of the health program. W is weaknesses. O is opportunities. And T is threats. SWOT analysis. Inventory control is a science where we do stock maintenance. Multiple techniques are there. Let's look at the two important techniques in that. ABC analysis. It is an abbreviation of always better control. Now what we do in always better control technique of inventory, we divide all the items used at a hospital or logistics into three categories ABC. Category A, which is only 10% of your items actually consume 70% of your budget. Category B items, 20% overall of all the items comprise or use 20% of the budget, which is logical. But look at category C, 70% of items in your hospital consume only 10% budget. Paracetamol, ORS, penicillin, erythromycin, tetracycline, doxycycline, they are so cheap and they still constitute the majority of items used in a hospital. VD analysis, this is again an abbreviation, vital, essential and desirable. We classify all the items in a hospital as VD, vital, essential, desirable, and we look at whether their absence we can tolerate or not. If you look, 10% of items you cannot tolerate their absence. Vital items, life-saving drugs, adrenaline, corticosteroid, anti-snake venom. 40% of the items are essential. You can tolerate for some time, some particular antibiotic. But 50% are desirable. You can tolerate their absence for long time. Combination drugs. Also remember, we have Psm1 analysis. This is based on movement, fast moving, slow moving, non-moving. XYZ analysis. This is based on your investment, whether it is high, medium or low. Then HML analysis. This is based on cost, high, intermediate, low. Then we have Golf analysis. This is based on the source of supplies, government, open market, local market or foreign market supplies. Then we have SOS, season, off-season items. Healthcare system of India, three things are important. One is the primary healthcare concept, the health centers in India and the health workers in India. We start with primary healthcare. When we look at definition of primary healthcare includes, as per Alma-Ata Conference 1978, that it is an essential healthcare which is characterized by 4 A's. What are these 4 A's? These are, it should be acceptable, accessible, available and affordable. These 4 A's are included in the definition of primary healthcare. When we look at elements of primary healthcare, elements of primary healthcare are total 8. How to remember?